Hello, I'm Dr. Tim Nelson, consulting physician in the Transplant Center, Mayo Clinic, located in Rochester, Minnesota. Regenerative medicine is a multidisciplinary field of stem cell biologists, bioengineers, and physicians and scientists. This multidisciplinary team of people aims to cure diseases with novel therapies such as stem cells and bioengineering. In other words, degenerative diseases is the opposite of regenerative medicine. As our bodies naturally age and break down, or we're born with a congenital defect, our bodies need stem cells to repair themselves. Using these stem cells to treat diseases such as heart disease, neurological diseases, and degenerative joint diseases, we can reverse the course of the disease and ultimately prevent a palliative chronic condition. Transplant medicine and surgery have pioneered this field over the last 5 decades. The aim of today's technology is to try to pioneer new innovations so that we can advance transplant medicine and surgery for the next generation. A common question that patients ask us is there stem cell therapies that can treat my condition? This is a very common question that we get. Frequently, when physicians tell patients that they require a transplant surgery and/or there's no options to treat their current condition, they often raise the question, is there a stem cell therapy that can treat me? They ask this question and frequently will search for alternative therapies and potentially stem cell therapies to treat themselves. This question can commonly be answered when patients log on to clinicaltrials.gov websites to gain more information on currently research protocols that may be appropriate for them. However, frequently patients then have questions, are they appropriate for these clinical trials? And we often try to sort through these situations with the patients and/or their physicians. At Mayo Clinic, we've developed a Regenerative Medicine Consult service that allows us to have a way to work through the process to answer these questions for individual patients. Where do stem cells come from and what type of stem cells are being used? This is a very common question, and unfortunately there's a lot of misunderstanding about the term stem cell. Stem cell is a very vague term that means many different things. Stem cells basically means that it is a type of cell that is able to rapidly grow and differentiate into many different types of tissues. This is similar to the idea of a seed. A seed can be planted and then eventually grow into many parts of a flower. Stem cells can come from many different sources. Commonly, they come from adult bone marrow stem cells, umbilical cord stem cells, or today we can now bioengineer stem cells from ordinary tissues such as your skin. Understanding the advantages of each stem cell type and applying that to the specific disease of interest is the important question that we all are asking ourselves today. For more information about the various types of stem cells, you can visit our website at mayoclinic.org. When will stem cell therapies be used to treat my condition? This is a very common question and is often the most difficult question to answer for individual patients. There is an intensive research effort ongoing both at Mayo Clinic and outside institutions dedicated to research and development of these technologies. The research and development of these technologies is highly unpredictable, dependent on factors such as regulatory guidelines, funding sources, and recent successes in the field. With the primary concern for the safety of our patients, we aim to accelerate the research and discovery of these technologies without jeopardizing the integrity and the validity of this technology and the process going forward. What are the first diseases that will be cured with stem cell therapies? This again is a very common question for our patients. Focusing on common debilitating, chronic, and common diseases such as heart disease, neurological diseases such as Parkinson's and/or diabetes, these tissues and these diseases have been the focus of much effort. One of the reasons these diseases have been the focus is because the stem cells that are lost in these diseases have also been the cell types that have been generated in the laboratory from various types of stem cells. Therefore, translating this technology into a transplantable solution into patients becomes a realistic and tangible goal for the future of transplant medicine and surgery. Beyond these common diseases, rare, severe forms of debilitating diseases can also become targets of regenerative therapies. This may become the future of regenerative therapies focusing on congenital diseases with structural and metabolic defects. What is induced pluripotent stem cells? Let me show you a video that explains this technology. As our body ages, we naturally have tissue breakdown, such that we have cell loss and tissues become weak. This, in the case of heart failure, can be shown here. With this new technology of induced pluripotent stem cells, it is now possible to envision the ability of taking a small piece of your skin, as shown here in this video, using this piece of skin to then grow in the laboratory culture to extract the cells known as a fibroblast. These are the ordinary cell types that live in your skin and contribute to wound healing. We then can grow these fibroblasts in culture and deliver a new genetic code into the brain center of these cells. This message provokes a new embryonic stem cell-like phenotype that allows the cells to undergo dramatic transformation. This process takes weeks to months to occur in the laboratory, but it allows us to then have the cells undergo cell metamorphosis and take on a new shape and structure, and ultimately create a new function of these cells. So in other words, we can start with an ordinary piece of your skin and send it back in time to reprogram so that it now becomes a cell known as an induced pluripotent stem cell. The advantage of these cell types is that they can then differentiate into the cardiac, neuronal or brain tissue, and even bone tissue, essentially any tissue of the body. In the case as shown here, we can generate functioning cardiac tissue that originated from these cells coming from your skin. So it's not hard for us to imagine the possibility of working towards a goal of delivering these cells back into a diseased heart that's weak and not functioning normally. If we could deliver these cells either by directly injecting them into the heart or delivering them to the body, they may be able to grow, divide, and differentiate into new heart muscle, and as shown here, contribute to an increased workload and help the heart work better. This type of technology, having started from your body and delivered back to your body, allows us to have an autologous cell-based therapy. As shown here for the heart, this technology can also be applicable to many other diseases. Beyond the therapeutic goals as highlighted in this video, there's other unique advantages of this technology, specifically in the context of novel discoveries, research and development, and potentially clinical diagnostics. To give you an example, it is now possible to take ordinary cells from your body, re-engineer them to create functional tissue such as the heart muscle. By doing this functional tissue in the laboratory, we now can compare that to your relatives, either healthy or diseased relatives, and that comparison can allow us to discover new mechanisms of disease. Beyond that, we can also use these cells in laboratory to do drug testing. We can test drugs on your cells, on your tissue, before we even give you, your body, the medication. This allows us to get information without being dependent on long-term clinical follow-ups for drug testing applications. Thank you for taking the time to listen and learn about our Regenerative Medicine Consult service and stem cell technology here at Mayo Clinic. It is an exciting time for research and development of stem cell-based therapies. We at Mayo Clinic, Rochester, Minnesota, in partnership with the staff of the Transplant Center, are working to develop clinical services to meet the unmet needs of our patients. For more information, please contact us at the number below or visit our website as listed. Thank you.